So today's meeting in Bath is focusing on brain tumours, and as an introduction really to the meeting, I've been talking about where we are in treating brain tumours at the moment. I'm an oncologist and I treat the brain tumours in the region. And really treatments haven't changed a lot over the last 20 years. What we do for our high-grade brain tumours at the moment is a course of radiotherapy with chemotherapy alongside, a drug called temozolomide. Patients usually get 6 weeks of radiotherapy with daily chemotherapy tablets, and then if they're well, they'll go on to monthly chemotherapy dosing for 5 days every month for up to 6 months. But really that was treatment dating back to the kind of late 90s in the trials. There's a paper by Roger Stupp that was published in the early 2000s, which showed that the combination of chemotherapy and radiotherapy over radiotherapy alone gave about 2.5 months survival benefit. Now, unfortunately, we're in a position where these tumours are poor prognosis. For high-grade brain tumours, glioblastomas, the average survival is 12 to 14 months. So we're getting some benefit by this new combined treatment, but really modest numbers. We confirmed that back in the mid-2000s, about 2005, we published the UK data looking at the combined regimen. And we saw similar results to the original trial in that people were living about 13 or 14 months on average with the combination. Things haven't changed in that time. We're really doing the same now. We talked a little bit today about improvements in radiotherapy techniques. We've got better imaging around the radiotherapy and better targeting of our radiotherapy targets with intensity modulated radiotherapy. So it's probably improved the tolerability of the treatment for patients, but not really the outcomes in terms of the cure rates or the length of control, at least, that people are getting. So the focus today really is to talk about ideas and research that's going on looking forwards and how we might improve that. So we had a discussion a little bit about things that we might look at. We might look at better molecular stratification of the tumours. Can we identify targets that we can exploit with new drugs? We talked about some of the new therapies like immunotherapy and PARP inhibitors. And there have been some trials ongoing in those drugs, but so far the results have been quite disappointing. We haven't seen anything yet which has changed our practice. So my hope from today is that we can sort of discuss some of the things that are in development and what we want to take forward is to improve our outcomes for patients. There are a couple of challenges with brain tumour patients that are peculiar to them. I mean, firstly, it's a very debilitating disease. The symptoms can be quite varied, but often patients are quite debilitated in their performance status, their ability to go about their everyday lives. It's more commonly associated with depression and psychological problems, perhaps, than other tumour types. And because the prognosis is poor, patients are going through quite intensive treatment for relatively small benefits. They're spending a lot of their remaining life in the hospital, coming up for visits for radiotherapy and chemotherapy. Added to that is the kind of practical issues. Many patients can't work, so they have financial worries. They need family support. They may have a problem with housing and dealing with things. Patients can't drive. They've had a brain tumour, so they're not allowed to drive, even if they felt capable of doing that. So even getting to the hospital can be a big issue for people. And the course of radiotherapy is 30 visits just for the radiotherapy treatment over a period of 6 weeks. That's a big impact for people if they're travelling a long way to the hospital and they haven't got family members who are able to bring them. Often it turns out that spouses or sons or daughters end up taking time off work as well, which has further financial impact on the whole family. So there's lots of issues around that. So I think it's key for patients with brain tumours that they've got good support around them, and that might be family, or it might be charities, it might be brain cancer specialist nurses who look after them in the hospital and can direct them to help, whether that's financial or practical help that they can get out in the community.